Pinkile Poto, an ailing infirm mother of 3, her kidneys are weakening each day. Kidneys remove waste products from the body and maintains a healthy balance of salts, water and minerals. Poto fears her final days are drawing near.
I
don't feel the same anymore. I live in fear that I might die anytime. My kidney gives me problems at times. When I get very sick, I worry about my kids. If I can get someone to donate me a kidney, I'd be very happy. It's almost 5 years since the 54-year-old found out that she urgently needs a new kidney. Before then, she had a near-fatal experience as her last kidney almost gave up. Her other kidney was removed when she was a child, and since 2019, the second kidney started failing too. I used to be very sick and couldn't do anything. I couldn't even walk. I can't believe that I'm still alive. Before falling ill, she was working for the city of Johannesburg. She registered in 2019 to be considered for a kidney transplant. Poto started dialysis in June 2020. This has been her fight for survival 3 times a week in a 4-hour session.
That's why
Dialysis is helping me a lot. I can live. I wouldn't be able to live my life without dialysis. Apart from the mental and emotional toll the weight has had on this family, the financial pressure is burgeoning. The average patient has to go for dialysis at least 3 times a week. Each session costs over 2,000 rand. So far, the medical aid had been paying, but funds are limited.
Run out of funds. I've managed to register her for her to have her own medical aid so that it can be able to sustain her as individual. And we are not part of that medical scheme because the funds would be running out like fast.
The Department of Health says the biggest challenge for those hoping to get an organ transplant remains the low organ donor availability in the country. Close to 3,000 South Africans are on the organ donation and transplant waiting list, which include kidneys. More often than not, most die without getting help, including children.
But the thing which keeps a long waiting list is finding compatible donors. One, in terms of just finding somebody willing to be tested whether they could be a compatible donor. So we would want to encourage South Africans to be more willing to help friends, family, to be tested as to whether you could be compatible, because that actually is the more long-term savior to somebody in kidney failure rather than renal dialysis, which is then becomes very demanding and has to be done twice or thrice a week.
According to the South African Kidney Foundation, there is hope for people like Poto, but the waiting list and post-transplant complications remain challenging.
And so to address this imbalance, we need to do 2 things. We need our people to be screened for kidney disease so that the diagnosis can be made early and treatment started to prevent them from developing kidney failure requiring a kidney transplant. But we also need our people to register as organ donors and to inform their family of their decision so that we can increase the number of donors in the country.
Poto has 2 children aged 22 and 12 and 1 grandchild. Her biggest wish is to be given a chance to see her children grow. Meanwhile, the Health Department and Kidney Foundation has called on all South Africans to be part of the organ donor network in the country in order to reduce the backlog to save lives and give people like Poto a fighting chance. Patricia Fasahi, SABC News in Alexandra.